There we go. Okay. All right. This is our treatment video. So, hey Ryan,
Hi.
nice to see you again.
Yep, it's good to be back.
All right. So, before we start, we're gonna go through the same order, not the same order, but going through some of the same steps as last time, just so we get some good measurements. We get a little bit of talking in before we go in and do some exercises. Okay.
Okay.
All right. So I did mention in the evaluation portion that we had you fill out this online outcome measures test, which just asked you a few questions about how you felt, kind of just to gain a little measure on some of your disability. And we scored it, and you scored a 15 out of 80, which is shows low disability, which is a good thing. It means that you feel like you're able to do things somewhat uninhibited by your surgery. But we will continue to use this every 3 to 5 visits, kind of based on your insurance, to measure your progress and see if we're making any objective progress. All right? Okay. All right. So, how did you feel after last visit?
I felt pretty good. I did have some back pain the past few days.
Okay.
It's gone a little bit worse, kind of lower back
Okay.
here, but I don't know. I think the exercises are pretty good. My knee's feeling a little better, so good.
Okay. So I guess we'll start with the knee and then we'll talk about the back a little bit. So for the knee, is it sticking within that same cycle that it's a little bit better in the morning, and then as you put more pressure through it, it gets a little worse, or has that changed at all?
Kind of the same, but I'd say it's a little less severe. So
good.
So same cycle, just doesn't get quite as bad.
Okay. And you mentioned it was a 4 out of 10 last time. What would you say it's at?
I'd say my knee. Yeah, I'd say it's probably 3, 4.
Okay.
But my back is probably closer to 6. So I don't know if it's just I'm distracted from it more.
Okay. And did you notice that you did anything differently that might have aggravated the back, or it's just starting to...
I don't know. It just kind of came up. I don't know. It's just kind of a dull ache, and as certain movements, I kind of feel a little bit of a sharp pain. But
does it go down your leg at all?
No, not really.
Not that you can tell?
No.
Okay. All right. Alrighty. Okay. So just kind of leads into our next thing, but no change in symptoms, just the swelling and a little bit of pain in the knee. But
the pain's in the knee's been decent. It's just
Okay. And how are the exercises going?
Good. Yeah, I really like the stretch. I just turn on my soap operas, Floppa.
Yeah.
So,
You love those soap operas, huh?
yeah, every day.
Every day. Wow.
Yeah.
Hours a day, probably.
Oh yeah.
That's amazing. Good. Okay. All right. So, kind of to go along the lines of what we talked about last time is keeping things simple and easy for you to do. As we progress and add exercises to your plan here, we'll take some things away or modify them at home. Okay. But each time we'll print you out a new sheet of the exercises we want you to be doing specifically at home. Okay. So that'll continue to repeat with all the exercises we've done in the past, and then taking things out and adding.
Okay.
Okay?
Sure.
All right. Before we get into a few of the measurements, any concerns you had from last appointment, anything you want to be addressed today?
No, not necessarily.
Okay.
So.
All right. Well, we'll look at the back, just check and see how your motion is, see if that changes with changing position, okay? All right, so before we get to the back, I'd like to start with the knee. So we already took some measurements last time, so I'm just gonna see if there's any decrease in the swelling based on our measurement of the knee, okay? All right, let's make sure we're using the same metric here. So you just relax as much as you can. So that has gone down about 1/8 of an inch, so we'll make note of that. That's a good thing. So as the swelling decreases in your knee, sometimes what that does is it allows for more joint space, and what that allows is for your knee to move a little bit better. Okay? So with that being said, we'll go ahead and take some measurements similar to last time of how well it moved. So what I'll have you do is I'll have you go ahead and kick your leg up. Alright. It's about a 6-degree improvement. It's pretty good. And then relax. And then I'll have you go ahead and pull that down towards your bottom. Quite a big improvement here as well. You're doing pretty well with those exercises, huh?
I've been doing them.
Good. That's great. So hopefully we can make some progress today then. I'm very happy that you're doing so well. And then I just want to check and see if there's any sensation change in the legs. This time you mentioned that there was some diminished, so decreased feeling in the back of your legs. So we'll just see if that's changed at all, okay? Alright, so I'm just going to kind of feel on both sides of the knee and you let me know how things feel, okay?
Okay.
So,
Same.
Correct.
Same.
and as we get back here,
That's where I just don't feel it as much, so both sides really.
okay. And I know it's kind of hard to recall since our first appointment was about a week ago. Any drastic changes in that?
I'd say, I think it's about the same if I remember right.
Okay. All right. Well, we'll make note of that. But now we'll go ahead and look at your back real quick. Go ahead and stand up if you can. All right. And then I want to go through some of those same motions we did last time, okay? And you let me know if that changes your symptoms at all.
Okay.
Okay, so go ahead and bend over slowly. Stop before you have a ton of pain. Come back up. Anything there?
Yeah, it's coming back up, I feel a little bit. Going down, not as much. So.
But it stays localized.
Yeah, it just stays like in the bottom. So I don't know if it's just muscles. Maybe I kind of tweak things a little bit.
It could be, yeah. You know, having the surgery in the knee kind of changes the way you're walking and shifting your weight.
Mm-hmm.
So that can always just affect your back.
Okay.
All right, and then hands on the hips, and we'll lean back. Good. Come back up.
Yeah, that one actually didn't hurt too bad.
Okay, so mainly with bending forward. And how about
And yeah, twisting I feel a little bit. So
okay.
yeah, kind of both ways I still feel crossed.
You can take a seat now. So you were saying, did you have this pain in the back, or some back pain when you first came in, and it just wasn't that significant?
Yeah, I guess I was feeling a little bit, but I guess I didn't notice it too much, or I forgot to mention it.
But now it's pretty significant.
Yeah, I notice it more now than I do the knee at this point.
Okay.
Obviously, I can't bend the knee as much, but still.
And have you done any therapy for the back in the past, or is this?
No, I have had like pain medications for it, but not as much therapy.
Okay.
The pain medications have helped, but they don't seem to help as much anymore.
All right. Well, not to alarm you, just with the back pain coming up and the medications not helping as much, I do want you to go ahead and talk to your doctor about that.
Okay.
So what I'll have you do is I'll get on the phone after our appointment and I'll call the physician, make sure we're both on the same page. But I'll have you go and see them and make sure things are going all right in the back. Okay?
Okay.
All right. So with that being said, we'll just do a few exercises. Just one of them is kind of working on some gait mechanics, and then the rest are working on specific things of getting more range of motion and strength. And then I'll kind of reiterate those as being your exercise program for home. We'll do a few things talking about education, making sure you're keeping up with your stuff, and then we'll address any questions, okay?
Okay.
All right. So, excuse me. The first one is called marching. So what I'll have you do is I'll have you stand up, and I'll have you go ahead and face me. Normally what I'll have you do is you'll go to like your countertop or something tall enough that you can keep your fingers on so you feel supported.
Mm-hmm.
And then I really want to focus on lifting your leg up. And
Just
not,
my right leg?
Yeah, so we'll
Okay.
start as high as you can without leaning over, and then we'll go back down, and then left leg up and down. And so for this first set, what I want you to try to do is do as many as you can, and then that'll kind of guide us on how many I want you to do throughout the day, okay?
Okay.
Good. So nice and slow. And we're keeping count here, okay? And then whenever you start to feel tired, you let me know, alright?
Okay. I'm at 8.
Mm-hmm. Good job not bending.
Starting to get a little tiring right here. I think this is 12 that I'm
Yeah.
on.
And you're starting to
Yeah.
lean, so we'll use 12 as our number.
Okay.
Okay. So I'd probably have them do a whole nother set, but for time's sake, we'll stick with one set of 12. Our prescription will be 2 sets of 12 for home. Probably doing it in the mirror with something nearby to support him so that he can get some external feedback on his exercises. All right. And then Ryan, I'll have you go ahead and sit up on the table. We did have some weakness in that quad, which is the muscle on top of your leg. So for that one, a really fun, easy exercise you can do kind of any time of day at home, sitting on the couch, is you sit there, you bring your leg up, and you're squeezing the top muscle. Good. And then back down. We'll hold for about 3 seconds at the top, okay? Good. Really activating there. 2, 3. Back down again. We're going to go till you start to feel tired, and that'll kind of base our prescription, okay? How's that feeling?
I think I got maybe 1 or 2 more left in me.
Okay. So that's about 6 right there.
Yeah. I can get 1 more in, but it's getting pretty difficult.
Okay. Well, I'm glad you're letting me know.
Yeah.
All right. So you take a break.
It's
So-
tired.
Yeah, good. Good. At home, I want you to stay aware of your limits. So if it's too much for you to do, you feel like you're going to just be exhausted for the rest of the day, cut it short a little bit.
Okay.
Obviously, you want to get better and you want to feel better. So,
So it'd be better to do these at night when I don't have as much stuff going on, so like I can rest in bed, or like.
to start, we'll start with twice a day, in
Okay.
the morning and night.
Okay.
And then as you get better, we'll increase the amount of times throughout the day.
Okay.
But if we just hold it to the nighttime, we're not going to get very much change.
Okay. Okay. Makes sense.
All right. And all this stuff will be written down in your exercise program. And we've kind of already talked about it. Doing those marching, making sure you're in your kitchen, find that counter space that you feel you're stable and you can hold on to. Really lift those knees up for this, on the couch. You don't need any equipment for this stuff. So it's all pretty doable, okay? All right. And then our next 2 exercises are going to be on our back. So I'll have you go ahead and lie down on your back, please. Slowly. So in our first appointment, we did those heel slides after doing the heat pack. Okay. But for this time, I'll grab my jacket. Actually, that'll work perfectly. So at home, if you have a towel or a dog leash, something long that you can wrap around your leg. So let's pretend it's long enough.
Okay.
Okay. So normally we did our heel slides where you were actively moving your leg up and down. But for this one, what I want you to do is start with your muscles to bring that heel towards your bottom. Good. And then once you feel like your muscles can't pull it any further, I want you to pull till you feel a stretch on that leg. And hold there.
That feels good.
Good. So we'll hold there for about 5 seconds. And then you'll straighten out.
All the way out, or?
All the way out, yeah. So normally we'd have something longer for you to grab onto. Really, again, at the bottom, try to straighten that leg as much as you can. Good. And then we'll pull back up. And for this one, we've already talked about, for this one, I'm going to give you a number to do. Again, take into aware your tolerance for it, but I do want you to kind of since this is a stretch, we do need to push it a little bit in order to get some necessary changes in the actual knee, in the structures of the knee itself, okay?
Okay.
And all these will be written down for you. All right, any questions with this one?
No, I think this is one I'll do at home.
Good, okay. And then I'll add one last one. Since there is some weakness on the sides of your hips there, we'll pretend like we have a band. All right, so let's bring those feet together. Good. So for this one, I want you to start by engaging your core muscles. So we've kind of talked about that before, tightening up the belly. Imagine we have our band. You're going to bring your knees apart and then squeeze at the end. Squeeze those glutes for about 2 seconds and then slowly bring it back in. And since we don't have resistance, we'll just make up a number for what his tolerance would be. Let's call it, 8. 8 sounds good. We'll do 2 sets of 8. Again, making sure we're not overdoing it. All right. Good job, Ryan. So I'll have you sit on up. And I'll go cut you a band so that you can do these at home.
Okay.
And you do have a towel that you can use, or like a dog leash to
Yeah.
on your leg. Good. All right. So just to reiterate, we're gonna change some of those exercises you're doing at home. I'd still like you to do the heat pack stretch to start everything, just to get your legs straight. Go right into those heel slides with the towel, and then you can work on the clam since you're already lying down with the band that I gave you. All the repetitions, times of day, that'll be in the paper, but we've already talked about that a little bit. And then lastly, we'll finish with the seated kick-ups, okay?
Okay.
All right. So a few things to talk about. We already talked about in the first appointment. Just keep avoiding the twisting, any sorts of excess pressure on the knee. Allow those tissues to really heal. I was like, okay. So continue to walk as you can with good posture, staying upright. Okay, keep walking upright, using good posture. The more you walk, the more you're using your muscles, the better. Again, exercises as prescribed. Don't overdo it. If you're feeling good, that's not giving you permission to do it 5 times a day. Okay. Stick to what we give you. We're working a good plan here. It's all gonna work out.
Okay.
Kind of going back to some of your goals, being able to walk unassisted and full motion of the knee and walking upstairs. As we get the range of motion and strength back, we can start working on some of those more functional things. But really, once we get the strength back, that's when things can really start to take off, okay? So I want you to, those goals are still being kept in mind, but we need to really address a few of those bigger impairments first before we get to those, okay?
Okay.
All right. And then our plan is gonna, I already talked to you about talking to your doctor, so I'll give them a ring and talk to them about your back. But we'll get that figured out one way or another, and then just continue as planned 3 times a week for 4 weeks. As we get better, we'll start to cut it down so it's once or twice a week for another 4 weeks, and then after that once a week.
Okay.
As you get better. And then any questions from you about how things are working here, or your exercise program for home?
No, but you said that you're gonna call my doctor. So then should I make an appointment then with them?
Yeah.
To kind of get that checked out.
Yeah.
Okay.
What I'm under the impression will happen is I'll talk to them and they'll have one of their staff call you to make an appointment.
Okay. I'll look out for that call.
Yeah. So if I would say if they don't call you within 24 hours, give them a call.
Mm-hmm.
Just make sure things don't get lost. But
okay.
yeah. I'm very optimistic with how things are going and looking forward to working with you in the future.
All right, thank you.
All
Until
right.
next time.
Until next time.